Only 2 words in terms of high-frequency ventilation. Probably high-frequency ventilation is the ventilatory strategy that has been most investigated in neonatology. You see here the number of trials from the early 90s to the 2000s. Many of them, and interestingly, many of the trials in the early years of use of high-frequency ventilation suggested that use of high frequency would reduce bronchopulmonary dysplasia or death. And again, these were mostly babies under 28 weeks, under 30 weeks. As the time moves on and we go into the 2000s, you can see that the difference between high-frequency ventilation and conventional ventilation in terms of BPD or death disappears. And I think that this is a very nice observation. And to me, this suggests that we really were probably not using conventional ventilation appropriately in the early stages of investigation of high-frequency ventilation. And as we learn what I have described in the last few minutes, how to use a conventional ventilation in a more gentle way, the advantage of high-frequency ventilation has disappeared. So in theory, high frequency should be advantageous because it provides ventilation with a very small tidal volume. And in that way, then reduces the risk of volume or barotrauma. And I think that without any doubt is an advantage, but normally we are using higher mean airway pressures with high frequency ventilation to maintain proper oxygenation. So we may be essentially canceling the advantage of using a low tidal volume with the fact that with high frequency we have to use a high mean airway pressure to achieve proper oxygenation, because if you don't use higher mean airway pressure, the lung tends to lose lung volume, lose FRC, and therefore the oxygenation decreases.